Vericel developed instruments specifically designed to enable a reproducible delivery of MACI arthroscopically. The arthroscopic measurement probe is used to measure the width and length of the cartilage defect. A cannula of the appropriate size is selected and placed perpendicular to the defect in an operating portal. Next, the selected arthroscopic cutter is inserted and deployed in the intercondylar notch, and then maneuvered over to the defect location to score the cartilage. 3 specially designed curettes allow for cartilage defect preparation. After satisfactory preparation, the cannula dam is removed, the joint is drained, and bleeding is controlled, and the defect is dried using the spongy tip of the MACI applicator. A MACI cutter, which matches the size and shape of the arthroscopic cutter, is used to cut the MACI membrane, resulting in an implant that fits the prepared defect. The V-shuttle delivery device is positioned adjacent to the MACI membrane. The MACI implant is gently draped cell side up symmetrically on the tip of the V-shuttle. A thin layer of fibrin sealant is applied to the defect area. Next, the V-shuttle is inserted into the cannula, and the implant is deployed and delivered to the defect. Finally, the silicone tip of the MACI applicator is used to adjust placement of the implant. Allow 3 minutes for the sealant to set up prior to manipulation. The repair tissue continues to mature over time, filling the defect to regenerate the damaged cartilage. The instruments are designed to provide an arthroscopic option to deliver MACI.
Indication: MACI, autologous cultured chondrocytes on porcine collagen membrane, is an autologous cellularized scaffold product indicated for the repair of single or multiple symptomatic, full-thickness cartilage defects of the knee, with or without bone involvement in adults. Limitations of use: effectiveness of MACI in joints other than the knee has not been established. Safety and effectiveness of MACI in patients over the age of 55 years have not been established. Important safety information: MACI is contraindicated in patients with a known history of hypersensitivity to gentamicin, other aminoglycosides, products of porcine or bovine origin, in patients with severe osteoarthritis of the knee, inflammatory arthritis, inflammatory joint disease, or uncorrected congenital blood coagulation disorders, in patients who have undergone prior knee surgery in the past 6 months, excluding surgery to procure a biopsy or a concomitant procedure to prepare the knee for a MACI implant, or in patients unable to cooperate with a physician-prescribed post-surgical rehabilitation program. Malignancy: the risk of MACI in patients with malignancy in the area of cartilage biopsy or implant is unknown. Expansion of malignant or dysplastic cells present in biopsy tissue during manufacture and subsequent implantation may be possible. Transmissible infectious diseases: because patients undergoing procedures associated with MACI are not routinely tested for transmissible infectious diseases, cartilage biopsy and MACI implant may carry risk of transmitting infectious diseases. Pre-surgical comorbidities: local inflammation or active infection in the bone, joint, and surrounding soft tissue, meniscal pathology, cruciate ligament instability and misalignment should be assessed and treated prior to or concurrent with MACI implantation. Product sterility: final sterility test results are not available at the time of shipping. The most frequently occurring adverse reactions reported for MACI, greater than or equal to 5%, were arthralgia, tendinitis, back pain, joint swelling, and joint effusion. Serious adverse reactions reported for MACI were arthralgia, cartilage injury, meniscus injury, treatment failure, and osteoarthritis. Use of MACI in pediatric patients younger than 18 years of age or in patients over 65 years of age has not been established. The MACI implant is not recommended during pregnancy. For implantations post-pregnancy, the safety of breastfeeding to an infant has not been determined. To report negative side effects, contact Vericel Corporation at 1-800-453-6948 or FDA at 1-800-FDA-1088, 1-800-332-1088, or www.fda.gov/MedWatch. For more information or to view full prescribing information, please go to maci.com.